Hi, I'm Sejal Brown, and today I'm going to talk about injury prevention for California's K-12 sports. Research has shown that there's been both an increase in participation in school sports as well as an increase in injuries. In Lyle Michelli's research, he stated, in recent years we have witnessed both an increase in participation of children and adolescents in organized sports. These trends have been paralleled by an increase in the number of sports-related injuries in this patient population. Children, it seems, are not only susceptible to overuse injuries, but may in fact be at increased risk as compared to their adult counterparts. The increase in injuries that student athletes have been experiencing is very concerning. It's important to see exactly how often are these students getting injured. In order to quantify this issue, I surveyed 30 athletes from California who are in high school or who have recently graduated. They reported on the injuries that they may or may not have sustained when they played school sports. In the graph on the right, you can see the distribution of sports by respondent. As you can see, the majority of high school sports has been represented in this data, however, they are not represented equally. The results of the survey show that 73% of the respondents sustained a major injury while playing their sport. The most common injuries were concussions, broken bones, muscle ligament or tendon tears, strains, and sprains. In addition to the short-term injuries, over 50% of respondents also felt negative long-term repercussions from their sports or injuries. The most common complaints were joint pain and limited mobility. These results are extremely concerning because the vast majority of athletes are getting injured. In addition to that, there is a high probability that they will have lifelong impacts from their sports or injuries. To learn more about this, I conducted interviews with both trainers, athletes, and coaches for a more qualitative insight. Of the coaches I talked to, Matt Ross was a JV football coach and Ben Maxwell was a varsity soccer coach. For the trainers, I talked to one personal trainer who was also a former athlete and one athletic trainer who's been practicing for 35 years. Lastly, I interviewed 3 athletes who play soccer, rugby, swim, water polo, and track to cover a wide variety of sports. In these interviews, there were many topics that were unanimously agreed upon, which I will address later in the presentation, starting with the fact that California's athletic environment is unlike anywhere else. California has one of the highest rates of student participation in school sports. This has created a uniquely competitive environment which comes with its own risks. The most important risk that I'd like to mention is that coaches sometimes force their players to play even when they're injured. And on the flip side, many players try and hide their injuries so that they can keep playing. I cannot emphasize this enough. A player's health must be more important than the wins or losses of the team. Unfortunately, a common cause of injury for young athletes is coaching errors. As Lyle Michelli states, most volunteer coaches are unaware of the young athlete's particular susceptibility to injury. Hence, our most vulnerable athletes are generally trained by our least experienced coaches. Yet even at a high school level, most coaches are undereducated and underqualified for their job, as the basic coaching certification requirement does not go in depth. In order to minimize the risk of overtraining players, coaches should follow the 10% rule, in which they do not increase the intensity of training more than 10% each week. This will minimize the risk of fatigue and overuse, which can cause strains, tears, joint pain, and mobility problems. As Lauren Cowley states, elevated fatigue levels, both physically and mentally, for a prolonged period of time can significantly increase the risk of injury due to the compromisation of muscle strength, coordination, mental attentiveness, and concentration. I want to emphasize the importance of the 10% rule because overtraining injuries are very common. Almost every coach is guilty of using conditioning as a punishment, and I urge you not to do that because it's extremely risky. Another adjustment that coaches can make to their training programs in order to minimize injuries is to add neuromuscular training. A research study of youth basketball revealed that regular use of neuromuscular training warm-up programs improves performance and prevents injuries. However, low level of adoption of these programs remains a problem. Coaches use parts of effective neuromuscular training warm-up programs, but balance exercises are not well adopted. I reviewed research on 3 different sports, and in each case it was clear that neuromuscular training greatly reduced injury about 20 to 30%. What is neuromuscular training exactly? Well, it's the combination of strength, flexibility, and balance exercises. As mentioned previously, the balance component is much less adopted as compared to the strength and flexibility. However, all three of these components are not vastly used in many coaching programs, and they should all be further implemented. One way to minimize coaching errors is to hire multiple coaches for different topics. This is already done for the majority of football teams, as they tend to have a head coach, an assistant coach, an offensive line, defensive line, and strength coaches. If a school can provide a strength coach, there's no reason this coach should be limited to the football team, and they should be accessible to all sports. In addition to this, coaches should be educated beyond the basic requirement for certification. In my coaching interviews, it was clear that the certification requirements do not go in depth. This leads to the vast number of coaches being underqualified, especially in the topic of injury prevention. Coaches should implement longer warm-ups with strict adherence to a program. Stretching and balance exercises are key, and practices like yoga are highly encouraged. Strength training is also very beneficial, but a high level of education and supervision from a coach is required. Coaches should follow the 10% rule to avoid overtraining and fatigue injuries, and they should do player check-ins in order to strengthen the player-coach relation so that players know if they're injured, they should sit out, and coaches do not try and force them to play. Poor health practices are another significant risk of injury for youth athletes. Almost every student athlete lacks in these three general health factors, which is why every season's parent meeting should address nutrition, hydration, and sleep. Dr. Lyle Michelli explains how having a proper diet can reduce the risk of fractures and bone breakage. Recent studies have detected deficiencies of calcium and vitamins in the diet of dancers, gymnasts, and distance runners. Many athletes also have decreased bone mineral density and a corresponding increase in the incidence of stress fractures. In addition to these benefits, having a healthy diet can also reduce inflammation and improve muscle recovery. My first recommendation would be to hire a nutritionist to advise athletes on their eating habits. This would be the most expensive but most effective solution. You could also require coaches to receive their nutrition certification, which will be much cheaper but also beneficial. Schools should also be encouraged to reform their lunch menus to better accommodate athletes' needs. And coaches should address nutrition routinely with parents, as eating habits tend to start in the home. Lastly, all coaches should be encouraged to educate themselves on this topic, as the basic certification requirements for coaches does not go in depth on these needs. Facilities, uniforms, and equipment are of the utmost importance for minimizing injuries. Ankle rolls and sprains are some of the most common injuries for athletes due to uneven fields and surfaces. Uniforms are also important, especially for contact sports. Any sport with a helmet must be of the highest quality to reduce the risk of concussion. Lastly, it is essential to have equipment up to standard, especially for weight training, as that is particularly dangerous for young athletes. In comparing these two images, you can see the huge difference that having high-quality equipment makes. The low-quality field on the right is very hazardous for tripping and sprained ankles. Since there have been a variety of practices mentioned that can reduce the risk of injury, I want to conclude with a financial distribution of each option. In the rightmost column, you can see the most expensive options, which will also be the most effective. However, no matter what is financially feasible, there is improvement that can be made. The first step is the most simple, spreading awareness to coaches, parents, and athletes about the risks of injury and the precautions they can take. Lastly, I wanted to include the sources of the extensive research I did, including numerous scientific studies. That concludes my presentation. Thank you for watching.